Black adults living in zip codes historically impacted by redlining have an 8% higher risk of developing heart failure than black adults in non-redlined areas. A study published Monday by the American Heart Association scientific journal Circulation says. During the early 20th century, U.S. banks routinely engaged in a racist lending practice known as redlining, which denied loans and insurance to black people seeking to purchase homes outside the undesirable areas of the cities. It said the practice began in the 1930s, amplifying segregation, and eventually was banned in the late 1960s. Say among black adults living in historically redlined communities, approximately half the access risk of heart failure appeared to be explained by higher levels of socioeconomic distress. It's an increased risk for hypertension and type 2 diabetes are among the other ailments that disproportionately affect black residents in the neighborhoods, according to the previous research. Although discriminatory housing policies were effectively outlawed nearly half a century ago, the relationship between historic redline practices and people's health today gives us unique insight into how historical policies may have been exerted, these efforts, on the health of many communities. Now, it said a cardiologist by the name of Dr. Shreya Rayo, an assistant professor in the Department of Internal Medicine at the University of Texas Health Science Center at San Antonio, said in a statement. Now, they said researchers analyzed data on more than 2.3 million residents. It said who were enrolled in Medicare between 2014 and 2019 by linking it with the residential zip code across the U.S. It said analysis included 801,452 participants who identified as black adults and nearly 1.6 million participants who self-identified as non-Hispanic white adults. Unlike the black adults, the study found that white adults living in communities with a high proportion of redlining did not have a higher risk of heart disease. It said the findings show us, the harm that discriminatory and racist housing policies they have had on generations of black adults and suggest the long-term impact of such policies on cardiovascular health disparities. And that was done by a Dr. Ambarish Panduri. But this is the thing. Yeah, you could say that, but this is the real issue here. The real issue is there's no good food in the black communities. You have these Chinese spots that's doing God knows what back there with the food in the black communities. You have a lot of fast food in the black communities, Burger King, McDonald's, Wendy's, etc., Popeyes. When you do have a grocery store, it's not the best produce in the world. So black people are not eating the best foods. That's really what it is. And it's affecting their health. Yes, that's part of it, affecting them with the neighborhood, but you do the research on what kind of grocery stores in those neighborhoods, what they putting in the food, how much preservatives in the food, and you can link all these diseases to food, because if you study it, the majority of the diseases in America is based on what we eat. If you clean up the food, then you won't have much of a problem anymore. And that's really all it is to it. Because we have to really pay attention to what we're eating on. The minimum ingredients that you see in food, the better. If it looks like they're writing a freaking chapter of a book, then that's something you don't need to be eating whatsoever.